to help us understand this issue. I would also like to thank the Cal State Fullerton Department of Public Health and all of our sponsors for support, as well as our co-host, the Southern California Agroecology and Sustainable Urban Food Systems Education and Research Conference, who are live streaming the symposium on campus at the Arboretum. I will now pass it on to the chair of the Department of Public Health here at Cal State Fullerton, Dr. Michelle Wood.
Good morning. I am Michelle Wood, Chair of the Department of Public Health here at Cal State Fullerton, and it is my great pleasure to welcome you to the inaugural CSUF Eta Sigma Gamma Food Insecurity Symposium. In the past few years, our community has faced a great many challenges, including a global pandemic, racially motivated violence, and more recently, global conflict and war. And that's a lot. We know that one way we can help manage feelings of chaos or being overwhelmed is to identify problems that we're passionate about and work to make a difference. My hope is that today's symposium will help us all do that by providing a rich understanding of some of the contextual factors influencing food insecurity, and also by helping us identify ways in which we can all contribute. So we have a great day planned. We are going to kick off our day by looking at how food insecurity affects families with young children. Next, we will explore countywide efforts to address food insecurity during the pandemic. And then we'll zoom in to focus on college campuses, wrapping up with a student poster session. We have amazing speakers today, representing the LA County Public Health Department's Nutrition and Physical Activity Program, Second Harvest Food Bank of Orange County, and the PHFE WIC program. In addition, we're going to hear from some stellar faculty at 3 different universities, CSU Northridge, CSU Fullerton, and my alma mater, UCLA. We will hear from representatives from 2 different campus organizations, Tuffy's Basic Needs Center and the Center for Healthy Neighborhoods. And lastly, we will hear the voice of our students. So expect a productive and rewarding day together. For making this conversation possible, I want to thank all of our guest speakers, and you'll get to learn a little bit more about them very soon. Our wonderful Eta Sigma Gamma Student Honor Society and all the participating students, our symposium co-director, Dr. Laura Chandler, and our symposium director, Dr. Tabashir Nobari, who had the vision, the heart, and commitment to bring this event to life. My gratitude and thanks to all of you. And now I'm going to turn it over to Leanne Din, who will moderate the first session. But let me tell you about her. Leanne Din is a health science major at CSUF, aspiring to become a PA. She's the events coordinator for Eta Sigma Gamma and a member of the Physician Assistants Coming Together, and a peer mentor. She believes that medical science is limitless, which is why she considers herself a lifelong learner. In her free time, she loves spending time with her friends and her dog named Thunder. So with that, have a terrific day and enjoy this symposium.
Thank you for your introduction, Dr. Wood. Good morning, everyone. My name is Leanne. I'm a health science major and the events coordinator for ESG, and I'll be moderating today's first session. So first off, thank you everyone and welcome everyone for making it to the symposium. For today's first session, we will be addressing food insecurity and how it affects families with young children. Our first speaker is May Wang, who is a professor of UCLA Community Health Sciences at the Fielding School of Public Health. Her research highlights the social and physical environmental variables on growth and development during childhood. And in the last decade, she led a team of researchers and practitioners to understand health disparities. And in the last 2 years, she had also been working with diverse groups to raise awareness and address food insecurity as well. And May Wang has her MA, her master's, and doctors in public health as well. And for her specific presentation, she will be highlighting what is food insecurity, why is it important to study, and what are some vulnerable populations. Our second speaker is Catherine Martinez, who is an associate data scientist for the PHFE WIC program, and she assists in the research and evaluation efforts to improve health among the LA County WIC participants. And she has her master's in public health with concentrations in epidemiology and global health, and she achieved that from Loma Linda University. And for her presentation, she will be highlighting food insecurity among WIC families with young kids, Spanish-speaking WIC families, and what WIC does to address food insecurity. And our last speaker is Amy Santos, who is an assistant center director at CSUF Center for Healthy Neighborhoods, which is a nonprofit community-based organization that aims to address the health and educational disparities among low-income families in Fullerton. Amy Santos has her Bachelor's of Science in Health Science with a minor in Child and Adolescent Studies, and she has her Master's of Public Health from CSUF. And she was also a former executive board member of ESG as well. And for her presentation, she will be talking about the CSUF Center for Healthy Neighborhoods approach to food insecurity. So with that, we have our introduction of all of our speakers. I want to mention that you guys can send in your questions during the presentation, and we'll be answering them after all three speakers have presented. And one last thing, we will be recording these sessions, which will be posted later on the website. And so, Mei Wang, we are excited to hear your presentation.
Oops, sorry. All right, I thought I had that up. Okay, can you guys hear me? You can see the slides? All right, so good morning, everyone. And thank you so much, Leanne, for the kind introduction. I'm so excited to be here today and want to thank all the conference planners and Dr. Nubari for inviting me to give this presentation. I'm going to be talking about what food insecurity is, kind of going back to basic definitions, and then talking a little bit about how it affects health, and a teeny bit about how it's being monitored and measured. And then I'll end with just really a brief overview of food policies in place, as you're going to be having many presentations today on WIC and other food assistance efforts. So before we begin, I kind of maybe wanted to just bring us all, to where we are today with regard to this, to food insecurity. I think the past 2 years, we've seen many reports in the media about food insecurity, about people standing in line for food. I got calls from many people, May, did you know this? Did you know that? And frankly, there were many subgroups that have been overlooked in the past that we didn't even, we hadn't even thought of to study in terms of food insecurity. One of those groups was Asian American elderly. And at the same time, we were seeing growing food insecurity rates in, other ethnic groups as well. So before I kind of get into this topic of food insecurity, I'd love you guys to maybe share a little bit about what you think food insecurity is, or food security is. So if you have a phone, feel free to scan that QR code or join slido.com and put in that number. And maybe we'll give everybody just 30 seconds. Don't think too hard about it, just read through it and see what you think would be the best definition of food security. Okay, let's take a look and see what you have, what this poll says. Okay, access by all people at all times to enough food for an active, healthy life. At a minimum, food security includes the ready availability of nutritionally adequate, safe foods and the assured ability to acquire acceptable foods in socially acceptable ways. So that was the most chosen answer. And voila, yes, that is the definition that we have today. But I want to kind of maybe bring us back over time. There are actually over 200 definitions of food security. In the 1970s and earlier, the definition was focused really more on the supply side, whether we had enough food available to sustain a steady expansion of food consumption and to offset fluctuations in production and prices. And I think very, very quickly people realized that food security is really about the people who are consuming the food. And so by 1986, the World Bank came up with a report on poverty and hunger. And that is the definition that you all chose. And it is also the definition that the US Department of Agriculture uses today. I'm going to repeat it because there's actually a lot in this very brief definition. Access by all people at all times to enough food for an active, healthy life. So think about it. At the very minimum, food security includes the ready availability of nutritionally adequate and safe foods and the assured ability to acquire acceptable foods in socially acceptable ways. And this is really important because, if we think of food security as really preventing hunger, then the solution would be to just provide food, not necessarily nutritionally adequate food or safe food that would be acquired, acceptable foods acquired in socially acceptable ways. I have to add that there's an effort right now to try to change the name of food security to kind of call it nutrition security. And I think USDA is now referring to it as nutrition security. Sometimes I see food and nutrition security. And there are a few of us who are maybe a little bit old school, and we're saying we've spent decades trying to come up with this definition. Why do we call it something else? And again, do we go from food when we use the word nutrition security? Are we giving the message inadvertently that it's only about nutrients and not about food as a whole? And that's really important because it's only about nutrients. We can have processed food with nutrients added to them. And now there's a lot of research showing that that's actually harmful to health, microbiome research and all. And so that's emerging research. So anyway, this debate goes on as to how do we refer to food security in a very holistic way. But the definition is there, and I think we need to honor that. So I'm going to move on now to talk a little bit about food insecurity and health. We know it's associated with poor health outcomes. Here are some examples. Decreased nutrient intakes, increased rates of mental health problems and depression, of physical health problems, diabetes, hypertension, hyperlipidemia and obesity, suboptimal growth in children, academic performance in school-aged and college students, and poor sleep outcomes. I'm sorry, I hope you guys are not hearing too much of the construction noise next to me. Okay, good. There's a lot of noise next door. And food insecure mothers, some studies have shown food insecure mothers are 2 times as likely to report mental health problems and over 3 times as likely to report oral health problems. So it affects moms, it affects adults, it affects families and children. And in terms of racial ethnic disparities in food insecurity, you can see the rates are higher in Blacks and Hispanics, and quite a bit lower in whites and others. And I'm showing the 2 bars show food insecurity rates between 2019 and 2020. And if you notice here, for Blacks and Hispanics, we saw an increase. With whites and other groups, it kind of stayed the same and maybe even dropped a little bit. And this is really important because it suggests strongly that whatever programs we have we're really not reaching out to the most vulnerable groups. And not surprisingly, food insecurity, racial ethnic disparities in health parallel those racial ethnic disparities in food insecurity. We have higher rates of hypertension, diabetes and obesity among Blacks and Hispanics compared to non-Hispanic whites. And there's a good amount of data on that. So I just want to now talk a little bit about how we measure food insecurity. There's an instrument, a set of questions that's been validated and developed by USDA and used in over a couple of decades. And that's being used, it's called the Household Food Security Scale. And it is used by the Census Bureau in the supplement to the current population survey. So this is a survey that's conducted by the Census Bureau annually of about a random sample of 50,000 households. It asks a bunch of questions, and there's a special supplement on assessment of food security. And to give you a sense of just the kinds of questions that are asked, I don't have time to go through all of this, but just very quickly, there's a set of about 9 questions for adults, and then more questions for children. And the first 3 questions are really statements where people are asked if these statements were often, sometimes, or never true for them in the last 12 months. And if you see this yellow line here, these are 2 statements that a group has validated to be pretty sensitive in terms of identifying people who are food insecure. It's not as accurate, but if you're in a situation where you cannot afford to ask all of these questions, those 2 questions seem to hold relatively good validity. Now, if you're able to ask all of those questions, as USDA does, or rather the supplement to the current population survey does, you're able to use that data to categorize food security into 4 categories. And USDA has developed a whole methodology around this. So the 4 categories of high food security, where there are really no indications of problems. There's marginal food security, where there are a couple of maybe reported indications, typically anxiety over food sufficiency or shortage of food in the house. And then there's low food security, which is really about reports of reduced quality, variety, or desirability, but little indication of reduced food intake. And then very low food security, where there is reduced food intake. And this is where, typically we think where hunger comes in. And all of these data are reported annually in this household food security report, which you can get at the USDA website. The state level data, there's data on food security in different demographic groups, really very rich data in there at the state and national levels. Just one example of the kinds of data that you can get from the annual report on food security. And I'm gonna ask you guys to maybe put in chat if you see anything surprising about these trends. This goes up to 2020, it's 2019, and this is the point for 2020. And what do you see here in terms of food insecurity? Has it increased? Has it stayed the same? And clearly, you can see here, you can see my arrow, according to this report, it stayed about the same. And yet I started off talking about food insecurity during the pandemic, the early months of the pandemic, where our group actually reported an increase in food insufficiency, which is a slightly different assessment tool, assessment question that was used by a different survey that was initiated only during the pandemic. That was a pulse survey. And so what's going on here? So we have to keep in mind that these surveys typically were conducted by phone or in person. And the in-person surveys were really conducted typically among the most vulnerable groups. And those are the groups who often don't have access to technology, smartphones, etc. So when the pandemic hit, and people, I think, well, we had a lot of problems conducting these surveys, let's put it this way. The in-person interviews were no longer possible. The phone interviews, expanded. We were doing a survey ourselves. Dr. Navari is involved in that study, and we had a really hard time getting people to pick up their phones, right? Because a lot of times people just don't pick up the phones. They think it's scam calls, and there was more and more of it during the pandemic. So there is concern that the estimates for 2020 are biased, and they're probably they're maybe underestimates. So that's something that I think the Census Bureau is trying to look more at. Anyway, that's just a quick overview of the kinds of data you can get from USDA. Just a couple words about food policies that are in place to address food insecurity. These are some of the programs, the food nutrition assistance programs that are administered by the U.S. Department of Agriculture with SNAP, which is known as CalFresh in California, that many of you may be familiar with. And that's the largest food assistance program in this country. Previously, it used to be called the Food Stamps Program. We have the school meals programs. The school lunch is probably something most, if not all of you, are familiar with. And we also have school breakfast and summer food programs. And then there's the WIC program that you're going to be hearing about very soon, and also the Child and Adult Care Food Program. And if you go to this website here, you'll see a longer listing of some other programs that USDA administers. I'm going to spend a few minutes just talking about the SNAP program very quickly. Who receives SNAP or CalFresh in California? 66% are in families with children. A little more than 1/3 are in families with elderly or disabled. 40%, 42% live in working households. This is actually really important because this says that a good number of people who are receiving SNAP are actually working and employed. So what does this say about wages, housing costs, and what is the idea behind this? We want to increase wages. How are we going to address this in the long term? So that's a good amount of research I think that we need to be doing in this particular area. And then more than 40% have incomes at or below the poverty line. So this is, the poverty line, as we know, is at a level where many people have very, very difficult times meeting their basic needs, including shelter. And then about 80% live in major metropolitan areas, and the majority do not receive cash welfare assistance. So very quickly, just to kind of give you a sense, you could get, there are many studies that have shown that SNAP does have positive impacts on food security, and also, in terms of improving nutrition. Here you can see, that SNAP has an impact on increased consumption of vegetables and poultry, and interestingly, is associated with decreased consumption in fast food and also in food insecurity. So I'm not going to go through this because I don't think I have time. I thought I'd put in the slide about online purchasing program. This SNAP now has an online purchasing program that was expanded during the pandemic. And this is something to watch out for. A lot of research needs to go into this. Is it really reaching the most vulnerable populations, or is it not? And then you can get information on how SNAP benefits are determined by going to the USDA website. It is based partly on the Thrifty Food Plan and on a formula that assumes that you spend 30% of your income on food. This is a formula that was derived more than 5 decades ago. It has finally, after many, many decades, the algorithm got revised. The Thrifty Food Plan got revised so that we actually now see an increase in SNAP benefits. And here you can see without that revision in the Thrifty Food Plan, SNAP benefits would actually be much lower than with the Thrifty Food Plan revision that took place just last year. And here are eligibility criteria. I think most of you are probably familiar with the 130% federal food poverty level. This is the national eligibility criteria. For California, states can actually increase that threshold. And here, if you're in Medi-Cal, you actually qualify for SNAP, or in TEMF, and that's at about 200% federal poverty level. There's a screening tool here, which is very interesting. You can kind of take a look at it, and then here you can kind of look at how you might qualify for CalFresh in the state of California. So with that, I hope I made it in time and that we have time for questions and answers. Thank you so much for your attention.
Thank you so much, May Wang, for your knowledge and introducing us to food insecurity. Our next speaker is Catherine Martinez, who is an associate data scientist for the PHFE WIC program. Catherine Martinez, we're excited to hear from your presentation.
Hi, everyone, and thank you, Dr. Wang, for a great presentation and an overview on food security. My name is Cat Martinez. I'm here representing the PHFE WIC program, which is one of the programs that May mentioned for combating food insecurity in our communities. I'm going to be talking about specifically Los Angeles County WIC program and how we have addressed food insecurity. So just a brief overview of WIC, the Special Supplemental Nutrition Program for Women, Infants, and Children, otherwise known as WIC for short, serves pregnant and postpartum women, infants, and children up to 5 years old in low-income families. Low income here is defined as less than 185% of the federal poverty level, and we provide nutritious food, nutrition education, breastfeeding support, and referrals to health and social services to over 270,000 women, infants, and children in Los Angeles County. Now, while my focus is going to be specifically on Los Angeles County, this data is really relevant to most of California because our statistics are pretty similar in surrounding communities. So throughout the nation, WIC organizations are devoted to improving nutrition and health among pregnant women and young children. So WIC is available throughout the entire United States. And specifically here in Los Angeles County, there are 7 local agencies that provide services in about 80 sites. So we're pretty widespread here. I will also mention that PHFE WIC is one of the largest WIC agencies throughout the nation. So we have an abundance of data to look at. Next, I want to walk you through our demographics because it's important to know what our population looks like for our WIC families. Here on the left, you can see for race ethnicity, we break it down into our typical Black, white, Asian, and other categories. But then we do split Hispanics by their language preference, English or Spanish speaking. We do this because in previous research, we have seen that health outcomes differ based on their language preference for this community. There are about 225,000 children under 5 participating in our WIC program here in LA County. And when we sum up the 2 languages, 81% of our participants are Hispanic or Latino. Next, we look at education because this is a demographic shift that we have seen over the years. Specifically focusing on this green line, we see that in 2020, 73% of WIC mothers reported 12 or more years of education, and this has steadily been increasing since 2002. So our families are more well educated as the years have gone by. Another shift in our demographics has been through language preference. So here in green, you see that English has been increasing over the years as well. So in 2020, 70% of our WIC participants preferred English compared to 46% in 2002. So we have been shifting from majority Spanish speaking to majority English speaking in more recent years. Next, as you saw from Dr. Wang's presentation, this is the definition for food security and how we look at the different categories of food insecurity for our rates. We start off with high food security and marginal food security, which is not primarily the focus when we're looking at different rates. And then for low food security and very low food security is how we have defined food insecurity rates for our data. When we look at low food security, this is when Dr. Wang also stated that we compromise on food quality or variety, or we reduce the food intake and disruption in eating patterns. And the difference between these two categories is how often it happens throughout a single 12-month period. So for low food security, we see that it happens in 2 months or less within the past year. And for very low food security, it happens in 3 or more months in the past year. So that is the difference between those two categories and the severity of food insecurity. Now I want to bring your attention to the comparisons that we make based on the regions compared to our WIC population. For the United States, as you see here on the left, 14.8% of WIC households with children in 2020 experienced food insecurity. Then in Los Angeles County in that same year, 26% of households experienced food insecurity. We wanted to further break it down by income because we do see that there are some stark differences based on income here in our county. For non-low income families, 20% were food insecure in 2020. And then when we move to look at low income families, it jumps to 42%. Please note that the low income here, the threshold is set at an income less than 300% FPL, which is different than our WIC families. Even though we are considered a program that serves low income, our thresholds are different. So that's why our rates at 29% for our WIC families more closely match those of the entire county. And as you remember from the previous presentation, inadequate food intake and poor food quality leads to mental health problems, poor health outcomes, developmental delays, and poor educational outcomes. And this is why it's important to continue to study food insecurity. Next, I want to bring attention to the other source of data that we collect here at PHFE WIC. We conduct a survey every 3 years since 2005. We started collecting data on food insecurity in 2011. And this is pretty much what we're trying to show trends across the survey years based on the different regions that we want to look at. In every survey year, we do survey about 5,000 WIC participants, and they answer the USDA 6-item food security tool. So from the tool that you saw previously, we select 6 of the questions that have been validated, and that is how we categorize them into the food security level. So starting with the United States, you can see that food insecurity rates were declining since 2011. And then in 2020, it shot up. The same trend is seen for LA County in our low income families and for WIC. So this trend is holding, and specifically it has to do with the pandemic because it is associated with a spike in the proportion of households who reported some degree of food insecurity in 2020. And to further look at our survey data, this chart is specifically focusing on race ethnicity because we do see health disparities in different racial ethnic groups. The chart is pretty much trying to compare the Los Angeles County average of food security throughout the entire county based on racial ethnic group, using that black line here that you see, and then comparing it to the survey years that we have looked at for our WIC population. So just as a, just to go through this, throughout Los Angeles County, non-Hispanic whites had the lowest rates of food insecurity in 2020 at 21%, compared to 28% for Asians, 39% for Blacks, and then 40% for Hispanic Latinos. So Hispanic Latinos had the highest rates and whites had the lowest rates for our county rates. This doesn't hold true for our WIC population. As you can see here, when we're looking specifically at the blue bars for 2020, Hispanic English speakers had the lowest rates of food insecurity for our WIC population, and Hispanic Spanish speakers had the highest rates of food insecurity in 2020. So there are differences when we're looking at our populations. The trends for decreasing food security are seen in most of our groups up until 2020. And then the only one that stands out is our Black community, where we actually saw a decrease in food insecurity reports for this community. And further analysis needs to be done to understand what exactly happened with our WIC participants in the Black and African American community. So then this leads me to talk about changes that we have made at WIC to provide more vegetables and fruits for families. Just as a brief overview, our program provides a WIC food package. That includes the foods that you see here, milk, eggs, bread, cheese, cereals, and fruits and vegetables for our families. So this is all prescribed to be as nutritious as possible for our families, and it is supplemental to their current diets. It's not supposed to meet all of their dietary needs. Now for fruits and vegetables, for the last 10 years, the monthly cash value benefit is a portion of that WIC food package, and we provide a dollar amount based on the category that the participants fall into. This could be for children or women. Children receive $9 and women receive $11 for the last 10 years. However, in June 2021, thanks to the American Rescue Act, WIC increased the amount that families receive for vegetables and fruits. And now children receive $24 a month, pregnant and postpartum participants receive $43 a month, and breastfeeding participants receive $47 a month. This has currently only been approved through September 2020. So we do want to say that any of you who advocate for families to have better nutrition and better health, it's something that we would encourage you to look further into to see how you can continue to advocate to keep this benefit going for families, because we have seen drastic increases in health and also in revenue for the state. As you can see, from June to December 2021, there was an increase in 23 million just from our agency alone spent on fruits and vegetables. So it's a great benefit for families and for the entire state. Now, I just want to direct you over to our brief that we have created that dives more fully into food security among our WIC community. This can be found on our website. Our website is lawicdata.org. And as you can see, we cover many more topics here. And there is a section where you can request more information if there's something that isn't available on the website. And finally, I just want to say thank you for the invitation to be here and present this information. And a special thanks to our funder, First 5LA, for all their support throughout these past 20 years where we have collected an abundance of data.
Thank you so much, Catherine Martinez. I really enjoyed your presentation and for letting us learn more about these statistics, specifically for WIC participants in LA County. So our next speaker is Amy Santos, which is the Assistant Center Director at CSUF Center for Healthy Neighborhoods.
Hello, good morning. If I may have Dr. Nabari share our slides. Thank you, Dr. Nabari.
Good morning, everyone. Welcome to the CSUF Center for Healthy Neighborhoods presentation. Today, we will be covering the center's approach to addressing food insecurity. Next slide, please. Before we begin our presentation, I'd like to introduce the speakers for today. First, I'd like to introduce myself. My name is Clara Arambula, and I am the Assistant Center Manager and Academic Success Program Coordinator. I'm also a former CSUF alumna, and I'd also like to introduce my colleague, Amy Santos. She's Assistant Director and Manager, and she's also a former CSUF alumna and ESG member. Next slide, please. The center's mission is that together with community residents and other stakeholders, we aim to alleviate education and health disparities, revitalize neighborhoods, and reduce the cycle of poverty for low-income children and families. The center offers free culturally appropriate programs and services which are identified by community resident needs. We then train Cal State Fullerton student interns and volunteers to provide trainings that promote education, health, and resilience. The center's philosophy is grounded in helping to empower residents to be resilient and self-sufficient and to make positive changes in their lives and their communities. Working together with our partners and supporters, we have the privilege and responsibility to provide a hand up to those in our communities who need a little extra help and resources. Next slide, please. The center was established by our Executive Director, Dr. Jesse Jones, in 2016. The city of Fullerton and Richmond Park had its only family resource center lose funding during the summer of 2015 and had to close. In an effort to fill a critical community need for family health and social services, the city of Fullerton offered a rent-free facility at Richmond Park to Cal State Fullerton to develop the CSUF Center for Healthy Neighborhoods. Since then, a dual partnership emerged between Cal State Fullerton and the city of Fullerton. The Center for Healthy Neighborhoods at Richmond Park is located within a densely populated, multicultural, multi-generational, and multilingual section of Fullerton. We are only 10 minutes away from Cal State Fullerton, and although we mainly cover the city of Fullerton and some areas in Placentia, Buena Park, Brea, Anaheim, and La Habra, we also are open to everyone, regardless of their place of residence. And additionally, all of our programs and services are at no cost to individuals and families. Next slide, please. In its 6th year of partnership with Cal State Fullerton and the city of Fullerton, the center continues to work with residents and other stakeholders to create healthy, safe, and vibrant neighborhoods. Our center works with vulnerable and marginalized individuals and families who are predominantly undocumented, or at least one family member is, and are monolingual Spanish speaking and have been trapped in poverty and fear for many years. We provide guidance and tools for them to implement proactive practices to break through systemic barriers which hold them down, such as racism, gender bias, limited access to affordable housing, quality education and healthcare, state and federal policies, or possibly their own perceived limitations and thoughts, beliefs, and actions. In addition, we work with resident leaders to empower them to navigate political systems and make policy changes for more equitable opportunities to thrive and succeed. A lot of the center's work by staff and center resident leaders during this time involves responding to the crisis faced due to the COVID-19 pandemic, such as loss of work and reduction in hours, food and housing insecurities, evictions, emotional and mental stress, unsafe neighborhoods, and the digital divide in the virtual world of technology. Currently, our average household is 4 people in a family. We have 38% of families participating in food assistance programs such as WIC or CalFresh. Lastly, the families we serve have an average yearly family income of less than $24,600. Most of the families we serve are in high need of basic needs, rental, and food assistance. Next slide, please. The center works in the community in 4 ways: staff and community involvement, linkages and referrals, community engagement, and programming for youth. Staff in the community are actively involved and work together to address community concerns and needs. Our center staff are bilingual, culturally competent, and trained to work with our families. We have developed confianza, or trust, in the community through relationship building and our community liaison, Igla Fluency. Community input and direction are a guiding force in our work. We ensure many opportunities to allow families to address concerns and feedback, such as or through our community forums and direct contact with center staff. Linkages and referrals are offered to community residents through walk-in, remote, and call-in services. We follow up with our communities to ensure that they receive appropriate support. We connect families to reliable and up-to-date resources or programs through existing community partnerships. Families are actively engaged with the center and their community. The community is working together to identify issues ranging from food insecurity to neighborhood safety and the upstream factors that contribute to those issues while empowering community members and building capacity. The key thing here is that it is driven by community, from deciding on the neighborhood issues to addressing on how, from deciding the neighborhood issue to deciding how to address it. The work cannot be done without the successful leadership of our volunteer parent resident leaders, which has 40 leaders. Most of them live in the Richmond neighborhood. And lastly, through our youth programs and summer camps, enrolled families are supported and connected to appropriate services and resources. Next slide, please. So some of the challenges faced by our center families with young children experiencing food insecurity are the following: ineligible for unemployment insurance, undocumented, at least one family member may be, language barriers, limited or no transportation, limited income or financial hardships, limited knowledge or awareness of food assistance programs or the application process, fear of retaliation or public charge, or many of them have been affected by COVID-19. Next slide, please.
Hello, everyone. I will be speaking about the ways that we have addressed such challenges. My name is Amy. So if we can have the slide be shown. I think it disappeared on my end. Thank you, Dr. Nabari. So while that is setting up, to address such challenges, the center has offered programs and events to families and young children. We have offered multiple events. We've offered food drives and holiday meals in partnership with local Fullerton restaurants in Orange County. We have resident leaders and staff deliver homemade meals. They're mostly nutritious meals to families who have been affected by COVID-19. We have offered meal vouchers to over 20 participating restaurants in Fullerton as part of the Feed Fullerton program, which I'll go into detail in the upcoming slides. We have offered on-site and off-site CalFresh and WIC referrals and signups. We've also offered emergency fund programs, gift card distribution to local grocery stores, basic need items, and we also have valuable partners and collaboration with the Fullerton School District and community partners that have allowed us to carry on this work. For this presentation, I will be providing and highlighting 4 of these efforts that we have offered. It seems that the slide is still not up.
Sorry, Amy, I've run into some technical issues, so Tiffany will be sharing the slides shortly.
Okay.
Is it this slide, Amy?
I can't see your screen, sorry.
It's showing up as a black box. There we
Okay.
go.
Yes, thank you so much. Thank you, Dr. Navari and Tiffany. Technical difficulties, right? We've gone through so many. All right, thank you so much. So this is just a little bit of what we covered regarding the different ways that we have addressed these challenges. Tiffany, if you don't mind going to the next slide. Thank you. So the center partnered with the City of Fullerton's Parks and Recreation to assist with enrollment and provide 490 adults, the majority who have children under the age of 17, with food vouchers through the Feed Fullerton program. This is a city-run program connecting low-income households with nutritious meals from local Fullerton eateries. To participate in this program, applicants must not participate in other federal and state nutrition programs such as CalFresh, and they must live in Fullerton. Families would have the option to use these vouchers for dine-in or takeout. Many families with limited transportation particularly enjoyed this program since many of the restaurants were at walking distance. Participating restaurants included Frame Border, Wobber Grill, Witch, the Simple Greek, Salt and Pepper Family Restaurant, and Monkey Business. Additionally, the center staff assisted directly with the application, submission of materials, and the voucher distribution to ensure that families were participating in this program. Next slide. Aware of our families' limited financial resources and limited access to foods, we have partnered with CalFresh and the Women, Infant, and Children WIC program to provide food assistance resources and enrollment. Before COVID-19, our center had direct representatives on site from each organization to provide enrollment, answer questions or concerns to families, and address any walk-ins. Now the center offers one-on-one case management support through a licensed clinical social worker and one master of social work intern to provide appointment setup, submit documents, and assist with any direct referrals to CalFresh and WIC. CalFresh and WIC representatives have connected remotely in person with our families, such as guest speakers or attend one of our parent workshops and provided informational sessions and outreach at special events. Next slide. There is always a tremendous need in our community, but it has been compounded by COVID. We have been able to provide emergency relief funds in the form of gift cards, meal vouchers, and debit cards that can be used whatever a family see fit. On multiple occasions, our staff and community residents have provided essential support to those in need. Here are some of the ways that we have worked with our families regarding funds. Families have received a $100 Target gift card to purchase fresh food and necessary household supplies that were in great demand. Due to changes in employment as a result of COVID-19, already struggling families had a more difficult time paying rent and maintaining the basic needs of housing. To alleviate such hardships, more than 300 families were assisted with application processes for emergency relief funds and basic needs through the City of Fullerton and homeless prevention funds such as United Way. Additionally, we've had private donations that have assisted over 200 families with $20 meal vouchers to local restaurants and groceries. Next slide. Emergency distribution events have been hosted in partnership with agencies that had access to food and high need item supplies. Not only did our staff and our resident leaders work together during these events, but under the leadership of our community liaison, Eglet Nunsi, we have been able to service our fellow community members. Local community resident leaders have volunteered their time to give back and attend these emergency distribution events, even though the pandemic has severely hurt them through job loss, illness, or feelings of uncertainty. Center staff and residents on multiple occasions provided essential support to those in need, primarily families with young children. All of our food distributions have been culturally appropriate foods and nutritious foods such as grains, fruits, veggies, dairy products, along with other staple items. Food drives have been located at school because we want to ensure that accessibility and walking distance for many of our families with young children. We have partnered with the Fullerton School District, with other organizations and food banks such as Second Harvest to continue these food distributions in the community. Next slide. And one of the strengths of our center is its time and commitment, where we have devoted to developing partnerships and collaboration within the university and community to not only bring services and programs and other resources to residents we serve, but also to help organizations serve vulnerable communities. The center has worked with the Fullerton School District and local agencies such as Pathways of Hope and food banks to provide families with these tangible and intangible resources to residents. We have over 60 partnerships and we're incredibly grateful for all of them. Next slide. We really want to highlight that it's not just the center providing these services to the community. It's important to the center's mission to empower residents to be resilient and self-sufficient, that they make positive changes in their families and neighborhoods. Resident leaders, parents of the community are volunteering their time and taking an active role in the community and providing leadership support and advocacy. The resident leaders have attended dozens of events to promote these efforts, have facilitated events to fellow resident leaders to receive food, supplies, have attended city council to advocate for policy change, and these resident leaders have worked with the school district to help develop new guidelines during the COVID era for meal distribution for students who depended on school lunches. They continue to work on these issues and overall improve the health and wellness of the children. And as a result, they have been recognized for their hard work and dedication to their community. Next slide. And in conclusion, we would like to highlight some of our successes with addressing food insecurity among families with young children. So we want to highlight the importance of partnerships, resident leaders in the community, and the impact that it has building trust between residents and valued partnerships. Next slide. And if you would like to get in contact with us, here is our contact information, myself, Clara, and our community liaison. Next slide. And here are our social media handles and our website if you would like to look into more details regarding our center. And lastly, last slide. We want to thank ESG for this opportunity and Cal State Fullerton for allowing us to be a part of the symposium, and all of our donors and partner organizations and resident leaders for making this a possibility to help our community. Thank you.
Good job, Amy and Clara. I really enjoyed your presentation because I felt like the school was listening and that they care about our health and they're doing things to better our nutrition. So just one last time, thank you for all the speakers for taking out time, creating these presentations and showing up today. And it shows you're very passionate about food insecurity. So before we get into our Q&A session, we did have a question from one of our faculty members, Mojgan Sami, who said, "Greetings, everyone. Thank you for such a great session. During discussion section, I'd love to hear speakers' thoughts on how the concept of food security has evolved over the last few years. For example, I see more focus on food sovereignty and food justice, as well as decolonized diets in the global health community." So if May, Wang, Catherine, Martinez, Amy, Santos, or Clara want to answer how food security evolved over the last few years, that would be great.
I'm happy to respond to that, share my thoughts. I think the last couple of years particularly, but this has been happening even before the pandemic. I think there has been increasing focus on the inequities in terms of the distribution of food. Well, I'm sorry, I should use distribution a bit judiciously. I'm thinking of the economic distribution, but the accessibility of food. You know, the research around food environments, neighborhood environments, is a lot of the kind of research that I focused on the last 20 years. That started in the late 1980s, early 1990s, when we started to have more information on it. And I think we're at a place right now where there clearly is a lot more interest in doing research around the food environment and accessibility, etc. And I was recently put on a nutrition education work group, and it was kind of interesting because there's right now this movement to try to focus more on the structural issues and the inequities, you know, at that level. But there's definitely a continued need for good nutrition education. But I think we really have not paid much attention to that in terms of exciting research moving forward. And I think that intersectionality, that need to kind of address both individual needs for knowledge, you know, for access, and then the structural barriers together, I think that's probably where I think we need to go in the coming years. So.
Thank you for answering that question. We have another question in the chat by Shayna Charles, and she says, "Thank you for all the wonderful presentations of program in LA County and Fullerton. Dr. Wang, do you find the new Census Neighborhood Pulse Survey data to be useful in examining food insecurity?"
Are you referring to the household pulse survey data?
Yes, sorry, I couldn't off the top of my head. I was just looking at the small business one this morning, but yes, the household pulse survey.
Okay, sorry, because I'm like, oh, this is something really new that I don't know. Great question. There's only one question in the household pulse survey, and we call it food insufficiency. There is one paper out there where they actually equate it to food insecurity, but it's really not a question. It's not a question that could be used to assess food insecurity. It's really basically whether, you know, how often I think it's about whether you have enough food to eat. Basically, that's it. And so, not sure how to answer this question without launching into. It is not adequate. It is the best we have right now to kind of look at to trends throughout the pandemic, because a household pulse survey was initially a weekly survey. and then it became a bi-weekly survey. So we have been actually analyzing that data over time. You can imagine the massive amounts of data that they collect week after week. So you can look at trends. You can also look at how it coincides with all those policy changes from the administration, increases in benefits, etc. But you can't really get too deep into the understanding what's really going on. We're trying to right now, we're working on a paper right now where we're actually seeing associations with, basically whether it's a blue or red state kind of thing, but they're merely associations. So yes, it does have its uses, but we have to use it really carefully. There's also a lot of concern around biases. It's the same as the supplement to the food security supplement to the current population survey, in that who were the people who answered the household pulse survey that was actually conducted online. I think there is concern that it's a pretty biased sample. So I shouldn't say pretty biased sample, a biased sample. And yes, it can be used, but it has to be used very carefully. Sorry, I couldn't give you a more direct answer.
No, that's great. Yeah, and I'm just interested in thinking about data for planning in general. So I'd love to hear the second part of the question. Leanne, I don't know if you want to read it or if you'd like me to just say it.
Oh yeah, sure. You can read it since it was your question.
Sure. I was just thinking about it as we were talking. So, I'd love to hear from both Ms. Martinez and Ms. Santos as the managers of programs. I'm sure you use a lot of data in your planning purposes. What do you not currently have? What are you thinking of as your big unknowns? And a city councilman mentioned to me a few years back about not really knowing about the overall WIC population in Fullerton, for example, not knowing in terms of the city, only being able to look at larger county level data. Is that still the case? Or what else do you feel like you would need?
So sorry, go ahead, Martinez.
Thanks. Sorry. So for the WIC side, we actually do have quite an abundance of data for Los Angeles County. However, it is something that we only get once a year. So it's not always as relevant as we want it to be. But, we make do, like Dr. Wang said, with what we can get. We actually did add food security questions to our screening for families when they enroll in the WIC program. So that's something that we're looking forward to having more information on soon. But in terms of getting data specifically for cities, we do have access within our county to going down to the zip code level. So it just depends on whether the WIC programs have somebody to actually look at this data. We are one of the largest agencies, as you know, so it's not often that there are analysts on a WIC program that can quickly look at data for specifics on food insecurity or anything that we have for the WIC program. But yeah, it's just a matter of like how timely our data can be.
I think for us, it would be great to look at census tract data of how many families are participating in these programs. And again, we are limited because of our location. We do service mostly the 92832 zip code area. And then in regards to Councilman Silva, I would say a little bit yes and no. So we have come across residents who are aware of the program, but again, they feel that there might be some retaliation. They feel that they don't qualify, they're undocumented, or they don't know that their children qualify. So it's a little combination of both. But overall, most of it is a little bit, in our case of our families, it's fear. So fear of retaliation, fear of public charge, fear like, how is this going to affect me long-term? Why am I providing this information, my child's information? So just the unknown.
Awesome. Thank you guys for answering Shayna's questions. We have two more questions really quickly by one of them by John Rawls. He says, I was wondering if members of the panel from LA County could speak to the work of the LA Food Policy Council. Considering the success of the CSUF Center for Healthy Neighborhoods, do you think that the LA Food Policy Council's approach is a model that OC County might benefit from adopting as a county-wide model?
Is there anyone from LA Food Policy Council here? If not, I'm happy to jump in a little bit. So I'm from UCLA, as you all know, so I'm going to be very careful about what I say because I don't know it all. I am on the LA County Food Equity Roundtable Advisory Committee, and oops, sorry, I forgot to connect my laptop to the power. So the LA Food Policy Council, I think it is a model that I think we aspire to try to create, establish, and implement, in the sense that it does involve a lot of different stakeholders. You know, it identifies people from representing different groups, and I'm, you know, without really knowing more of the specifics of Orange County, I think all counties could probably benefit from just identifying who the key stakeholders are specific to that county, in terms so that you can actually, we can kind of move forward in terms of policy changes and in terms of making decisions. And it's part of it is, how do we establish that council so that it actually represents all of the different voices, and you know, how do we keep that going over the years? The resources that would allow this to kind of continue. So you know, the Food Equity Roundtable in LA County came about during the pandemic, and it really has a slightly different focus than the LA Food Policy Council, in the sense that it's trying to address the food inequities that kind of really surfaced during the pandemic, and it wants to try to address the entire food system. And when I say entire food system, I'm talking from agriculture production all the way to consumption. And that's something that, you know, is incredibly difficult to do. We find ourselves always wanting to focus more on the consumption end. You know, by consumption, I mean the people who were being served, who need help, assistance. But then what about the growers and the producers, the local farmers? We saw how many farm workers were affected during the pandemic, you know, and so I think Orange County would probably need to be kind of identifying what the critical issues are and who are the stakeholders, to kind of create some kind of a council or a coalition that would address this needs, that would try to identify the needs and then figure a way to address those needs in the coming years.
Okay, thank you so much, everyone, for answering these questions. It's 10:39. The next session starts in 1 minute. And I know there is one question left, but I do want to leave time for a break if anyone needs so. So thank you for coming and speaking, everyone. It was a pleasure just hearing from you guys. Thank you.
All right, so it's just past 10:40. I will begin the second session now. So welcome everyone to our second session for the Food Insecurity Symposium. We will be addressing county-wide efforts to address food insecurity during the pandemic. And just a reminder, this is being recorded and will be posted at a later date. And again, hello, my name is Shah-Patel. I'm the Financial Officer and Fundraising Chair for Eta Sigma Gamma. The speakers we have for this session are Dr. Julia Caldwell, Dipa Shah-Patel, and Claudia Keller. We'll begin with some introductions. So Dr. Julia Caldwell is a Chief of Research and Evaluation for the Nutrition and Physical Activity Program at the LA County Department of Public Health. Dr. Caldwell currently leads evaluation efforts for LA County's SNAP education program and the Produce Prescription Project. Dr. Caldwell received a master's in public health and a PhD in public health from UCLA and completed a postdoctoral fellowship at the University of Chicago. Moving on to Dipa Shah-Patel, she directs the LA County Public Health Department's Nutrition and Physical Activity Program. Under her leadership, the Nutrition and Physical Activity Program has shifted its focus to addressing upstream factors that impact diet-related diseases, including food insecurity and poverty. Dipa was instrumental in the development of several board motions adopted by the LA County Board of Supervisors, focused on screening for food insecurity in county clinics and reducing food waste and food insecurity. For the past year, she has served on LA County's Food Security Branch, established by the Office of Emergency Management to respond to the growing prevalence of food insecurity as a result from the pandemic. Dipa received both her BA in History with a minor in Education and her MPH in Community Health Sciences from UCLA. She is also a registered dietitian. Last but not least, Claudia Bonilla-Keller is an established nonprofit executive. She joined Second Harvest Food Bank of Orange County as Chief Mission Officer in February 2020 and was named CEO on January 1st, 2022. Keller leads all aspects of food bank operations, including outreach to donors, community partners, volunteers, and the public to educate, inform, and inspire action on Second Harvest's focus of ensuring that all Orange County residents in need are well fed. Prior to Second Harvest, Keller served as Chief Program Officer for the LA Promise Fund and as Senior Vice President and Executive Director of the AHA in Los Angeles. Keller holds a bachelor's degree in political science from UC Irvine and a master's degree in public administration with a concentration in urban management from Cal State Fullerton. We will now begin with our first presentation, and please feel free to send in your questions or comments during the presentation through the chat tool, and we'll have time to address those questions to our speakers at the end. And I'm going to pull up the slides. And I'll hand it over to Dr. Julia Caldwell and Dipa Shah-Patel to speak on improving food insecurity in Los Angeles County.
Thanks so much, and good morning, everyone. Thank you to Dr. Nabari and Reina and the Eta Sigma Gamma for allowing us to speak today. So today I'm going to be talking about and introducing our presentation with some data on food insecurity in LA County. The data is from a report that the Department of Public Health put out last November. And then Dipa Shah-Patel is going to be presenting on some recommendations and programs that our program is working on. So next slide. So what is food insecurity? For this presentation, we're using a USDA definition. So a household is food insecure if it A, reports a reduction in the quality, variety, or desirability of a diet with little or no indication of reduced food intake, so low food security, or B, reports multiple indications of disrupted eating patterns and reduced food intake, very low food security. I'm not going to focus on kind of the whole background of food insecurity. I feel like the previous presentation did a great job of that, but we do recognize that, food insecurity is caused by complex set of problems, including things like structural racism, unemployment, affordable housing. So if you go to the next slide, please. So I'm going to be presenting on two data sources. The first is the LA County Health Survey. So this is a telephone-based cross-sectional population-based survey of residents in LA County. It's conducted about every 3 years. The sample size for 2018, which is most of this data that I'm presenting today, is about 7,000 adults. There is a 2022 data effort going on right now, so we're looking forward to that data when it comes out and kind of the impact of our program on that. To assess food insecurity in the survey, LA County Health Survey participants are administered a set of questions, but only if they have household incomes less than 300% of the federal poverty level. So that's about approximately $73,000 for a family of 4. And they're asked 6 questions from the USDA short form food insecurity module. Next slide, please. I'll also be presenting briefly on the Understanding Coronavirus in America study. So this work was conducted during the pandemic from early April 2020 to July 2020, and then again April 2020 and December 2020. The sample size is smaller for this, it's 1,400 adults. And to assess food insecurity, participants are asked 3 questions from a validated food insecurity experience survey. Should note, though, there shouldn't be really a direct comparison between these 2 studies just because it's a different set of questions that were asked, and also LA County Health Survey is only asked among low-income populations. So next slide. So here's the trends in LA County. Food insecurity trends among households with less than 300% FPL. If you look at the orange line you'll see that food insecurity steadily increased from 25.5% in 2005 to 30.6% in 2011, and then kind of leveling off to ending at 26.8% in 2018. This is approximately 416,000 households in LA County are experiencing food insecurity. You can see that for the red line on the bottom, very low food insecurity parallels kind of this overall food insecurity trend. Next slide. So this is a map showing the percentage of households experiencing food insecurity by service planning area. If you're not familiar with LA County, there's 8 service planning areas, and these regions allow our department to provide more targeted public health services. So as you can see, the experiences of food insecurity are not equal across LA County. The highest prevalence can be seen in the South SPA, 35.1%, and the lowest prevalence in the West SPA. So South SPA includes communities like Compton, Crenshaw, and Watts and surrounding areas, whereas the West includes communities like Beverly Hills, Santa Monica, and Malibu. Next slide. Now I'm going to talk about the sociodemographic characteristics of food insecurity. So the data shows that 67.3% of food insecure households were Latino, 11.9% African American, 13.9% white, and 6.2% Asians. If you think about these numbers in the context of kind of the overall racial demographics of the county, so Latinos comprise 48% in the county, African Americans comprise 8.5%. If we, are aiming towards racial and health equity, right, we'd want those percentages to be more closely aligned. You can also see here among adults living in food insecure households, nearly half were employed. So this kind of public perception is that under or unemployed individuals are the ones who are food insecure. But you can see that there are people who are working and also experiencing food insecurity. I think that May brought up in her talk, indicating kind of the higher cost of living, stagnant wages, and things along those lines. And the last point here, among adults living in food insecure households with less than 185% of the federal poverty level. That's kind of a general threshold we use for eligibility for CalFresh or food stamps. A third participated in the program. Next slide. This chart focuses on healthcare access among food insecure and food secure households. If you look at the pink or magenta bar, you can see that among households with incomes less than 300% FPL, a higher percentage of food insecure households reported difficulty accessing medical care when they needed it. So 45.1% compared to those living in food secure households at 22.9. And next slide. This slide shows the percent of adults with chronic conditions in households less than 300% FPL. I realize that it's missing actually the fifth bar there, sorry, the dark blue. That should be current depression. But overall, you can see that the prevalence of obesity, diabetes, hypertension, high cholesterol, and current depression were higher among adults living in food insecure households than among those in food secure households. Next slide. So this is going to be my last slide. So this is the Understanding Coronavirus in America study, which provided us data during the COVID-19 pandemic because, right, the LA County Health Survey stopped in 2018. During the COVID-19 pandemic, you can see that communities of color were hit the hardest. Latinos experienced the highest prevalence of food insecurity in LA County at 40%, followed by African Americans, Asians, and whites. The next point here kind of shows that CalFresh or food stamps are intended to help kind of transition families from food insecure to food secure. So this data showed that after controlling for financial support, employment, and poverty level, participants who received CalFresh in June and July of 2020 had 80% higher chance of transitioning from being food insecure in April, May to being food secure in June and July. And then the last point, between 14.7% and 26.7% of LA County households were likely eligible for CalFresh, but were not enrolled in the program during July of 2020. So this kind of shows that there continues to be gaps in enrollment and kind of opportunities actually for our program and for others in LA County to help folks to get enrolled in these programs. So I'm going to stop there and I'm going to turn it over to Dipa. Thank you.
Thank you. Hi, everyone. As Dr. Caldwell mentioned, thank you, Dr. Tabari, for the invitation to speak for us to speak with you all today. Really, what a fantastic forum, great speakers, and on an issue that's so important. And I always say that it is surprising to me still that in the United States that we have such issues of food insecurity, being one of the wealthiest nations, arguably in the world, that we struggle with this. And it's not to say that there is not enough food that is produced in the United States. Certainly, we produce enough to feed all of our citizens and residents. And also additional countries even in the world. But these issues of imbalance and inequities have resulted in largely from failed social and economic policies. So as Dr. Caldwell has mentioned and shared with you, our department monitors and tracks food insecurity, and then also provides a set of recommendations for multi-sectors, different sectors to on how to address food insecurity. So I'm going to go through some of these recommendations. Can I take the next slide? So we have about 8 recommendations that are outlined in this report. I'm not going to focus on all 8. I know that previous speakers have spoken about some recommendations, including SNAP, which is the largest anti-hunger and poverty program. So there's a recommendation on that, and there's some recommendation on data sharing. I'll take the next slide. I'm going to focus specifically on 6 recommendations and how those recommendations, how in the nutrition and physical activity program, we're using this data and recommendations to inform our programming. So the first recommendation that we have here is recognizing and promoting health equity by recognizing the relationship between food equity and racial equity. So we know that to achieve health equity, we have to recognize this relationship. And these factors, certain factors really influence health equity that are tied so closely to racial equity as well, that impact our food and nutrition security status. So these factors include cost of living and how housing in the county. We know across LA County and Orange County how much housing has increased, and anti-immigrant sentiment, structural racism, and then also the lasting impacts of redlining and zoning. So we know that the way that investments were made in communities were really impacted based on structural racism. And what has happened is that they've resulted in pockets of concentrated poverty, where there's what some call food deserts. What food justice advocates are utilizing right now is a term of food apartheid, rather than food deserts, because it describes more of that structural, social, and racial inequities of the food system. And it acknowledges that these policies and practices have resulted in these inequities. The recommendation suggests that we work across sectors in partnership with trusted organizations that can not only help to ensure all low-income individuals are supported in accessing food resources and enrolling in nutrition assistance programs, but also can help transform communities in our county to promote food justice and health equity. Dr. Wang talked about the newly established Food Equity Roundtable that she and I are both part of, that this really shows promise on building a more equitable and just food system. If I could take the next slide, that'd be great. This next slide talks about shifting the focus of government and healthcare and policymakers from food insecurity to nutrition security. Dr. Wang also talked about this. And I think I was with her in the beginning because I thought, USDA already has this definition, low food security, which really talks about the quality and variety of food. We all, it was already there. But really, as I've been thinking about this, having this term about nutrition security, really focusing on consistent access, availability, affordability of foods and beverages that promote well-being and prevent and treat disease. This recommendation talks about that there's food insecurity is usually addressed by anti-hunger movement or anti-hunger advocates. And then there's the nutrition security focus that has really a health lens to things. These distinct efforts that have oftentimes different strategies are brought together to address these current challenges that we have, especially when we're talking about disparities of diet-related chronic diseases that really impact vulnerable communities disproportionately. So when we talk about nutrition security, there's a nuance to that. When USDA has like number of questions that actually ask about, to measure food insecurity, but when we kind of tweak it a little bit to ask specifically about nutrition security, we get a nuance. So we might say like the questions for food insecurity might ask or might address to like, do people have enough food that lasts throughout the month? But nutrition security questions can address maybe food availability. They can address issues of maybe not having the knowledge or skills to prepare healthy meals. So we can kind of, when we're doing programming or targeting, using targeted investments or making targeted investments, we can really address the issue that needs to be addressed. So what's very exciting, I'll take the next slide, is that in our LA County Health Survey and coming up in this year, 2022, we're going to be able to ask some questions about nutrition security. So these questions will help us as a county when we're doing planning and developing and implementing programs. that we'll be able to look at our county as a whole and see what are some of the issues that specific communities are facing, and then direct resources towards addressing those issues. Next slide. Another recommendation in the report was to expand nutrition incentive programs to help stretch these CalFresh dollars and WIC dollars to help increase access to quality resources for low-income foods. So as Dr. Caldwell had mentioned, SNAP benefits are, of course, in the name, they're supplemental in nature. They're not going to provide the full, full food budget or cover the food budget. So there's these wonderful programs such as Market Match. And I know that the Market Match is implemented in the Anaheim Farmers Market because I've been there, and it's wonderful. There's tokens that you receive. So for those of you who are not familiar with this program, you if you are participating in SNAP, you use $10 and then you receive $20 in like scrip or tokens to utilize at the farmers market to buy fresh produce. So it really doubles the value of some of these benefits to help communities eat healthier. And this is a win-win for farmers and producers, as well as improving community food security, food and nutrition security, I should say. Next slide. So with these American Rescue Plan Act dollars, Los Angeles County received $2 billion of funding from the American Rescue Plan Act. And 2 million of these dollars will go towards expanding Market Match in LA County. So we've got 30 farmers markets in LA County, throughout LA County, that implement Market Match currently, out of the 130, I think, farmers markets there are throughout LA County. And what we're going to be doing with this program, as when we're thinking about equity and we're thinking about maximizing these dollars, is that right now in the green part of LA County, there's no Market Match going on. So with this funding, we'd like to expand Market Match to these 3 geographic locations in LA County, which is the South LA, sort of the Northeast San Fernando Valley, and then Antelope Valley in LA County. We'll be implementing Market Match in at least 15 total farmers markets in historically underserved communities, and then complete 70,000 Market Match transactions by the end of the program. Next slide. Another recommendation in the report is to support a social safety net program for individuals who are undocumented and or have mixed status households at the county level. And the reason I think why this recommendation was included was because those who are undocumented or live in mixed status households often are not eligible or have a fear of participating in federally funded nutrition assistance programs like CalFresh or WIC. And so for the county to create another program for individuals who are undocumented is really important. We want to make sure that everyone in LA County does have access to food. So I think that the slide, it may be out of order, but I'll take the next slide and then we'll, yeah. Can you actually, Raina, can you just go maybe 2 slides? I think that somehow, can you advance it 2 slides? We'll come back to healthcare. I just want to be able to, next slide. Next slide. There we go. Thank you. Okay, so again, with the American Rescue Plan Act funding, so $2 million in Market Match, and then $10 million was allocated towards the grocery voucher program, and then the nutrition and physical activity program will be implementing this as well. So with these $10 million, we would like to increase purchasing power for 10,000 low-income vulnerable households with grocery vouchers between $600 and $950, depending on the family size, to be able to go into a grocery store and purchase what the family needs. There will also be an online purchasing and delivery option because there's only 2 grocery stores that actually meet our criteria because we were using a gift card that the grocery store will be providing a gift card. One is at Northgate Gonzalez Markets, the other one is at Albertsons. And there's certain restrictions that have to be on it, like you can't purchase cigarettes, no alcohol, tobacco, lottery tickets, ammunition. I guess that's in some grocery stores you can buy that. I haven't seen that in California yet. But so only 2 grocery stores are going to be participating because they are able to provide these limitations. So we do want to be able to provide an online purchasing and delivery option. So we'll be doing this in partnership with CBOs. About 5 to 10 community-based organizations will help us do outreach, enrollment, and really get the word out to specifically immigrant communities and opportunity youth who are really disconnected from school or work and are highly vulnerable and do experience high levels of food insecurity. Raina, can you take me back to the healthcare recommendation? Thank you. Okay. All right. One of the other recommendations was to engage the healthcare sector to expand food insecurity screening and then implement programs like produce prescription and do produce distributions. So the healthcare sector is an amazing place where people are already going to seek services. They can be identified at questions. There's a 2-item validated questionnaire that can be asked of patients to ask if they're experiencing food insecurity. Next slide. And then, of course, with that information, how do what do you do with that information? Of course, the number one is to link patients to federally funded nutrition assistance programs. But one of the things that we are doing as a team, we applied for some funding for the Gus Schumacher Nutrition Incentive Program, specifically their produce prescription project, where our goal was to see if we could increase fruit and vegetable intake among pre-diabetic and diabetic Medi-Cal recipients in LA County. We've got 3 partners for that: Northeast Valley Health Corporation, Venice Family Clinic, and Asian Pacific Healthcare Venture. And our goal is to increase fruit and vegetable consumption, improve household food security, and then reduce the risk of developing diet-related chronic diseases and their complications. So we'll be actually measuring hemoglobin A1C as well as blood pressure and trying to see if we, by giving a $40 gift card to buy fresh fruits and vegetables, does that have an impact on patients' health? So next slide. You can kind of see how the flow of this works. A patient is screened at the healthcare clinic, and then they are referred to the program. They participate in the program for 6 months, and then, like I said, they receive $40 a month. They're referred to nutrition education classes, and we will also be evaluating everything. Dr. Caldwell mentioned she's a lead on the evaluation for this, and we're very excited to see if how impactful these types of programs can be. And then patients can use this card. They can use the card at a variety of different grocery stores that are in a geographic area that's close to the clinic. Next slide. And we'll skip this one. Okay, thank you. Okay, so this recommendation is about investing in food recovery systems throughout Los Angeles County to increase food resources. Next slide. In our region, about 1.7 million tons of food is thrown away every year. And that waste happens really from growers and producers to retail to individual waste. But when we're looking at waste that happens really between the producers and the retail level, it is like so much fresh fruits and vegetables that is wasted every year. And what that, of course, that's a problem that we have, but it also creates an environmental impact. When produce, edible waste, breaks down, it releases methane, which is a greenhouse gas, contributes to the warming of our planet. And California has adopted a piece of legislation, SB 1383, that really talks about diverting edible organic waste away from landfills and into communities in need. So next slide. With our CalFresh Healthy Living, our SNAP Ed funding, we've created a system, an infrastructure of partnerships where we work with food rescue organizations to pick up that great produce, broccoli, carrots, asparagus, plums, strawberries, and then work with organizations that can quickly redistribute it. You can see here, this is during the pandemic, so we've got these grab and go bags. We've got nutrition education happening, cookbooks being distributed so that people not only receive nutrition education messaging, but then they receive a bag of fresh, free produce. Next slide. So we can see with this food redistribution work, to date, since October of 2020, we've conducted 715 produce distributions by our funded partners. served over 250,000 households, and redistributed over 3.7 million pounds of produce. So all of that produce would have gone to waste and gone into a landfill. We were able to redirect it to communities in need. And then, just a simple graph on the right, that the quality, 57% of people said that the quality, the produce that they received was of good quality and was fresh. So that was really good, because we know that we're always fighting against time and transportation of that produce, because it spoils quickly. So we want to make sure that it's redistributed very efficiently. Next slide. Okay, thank you for the reminder. I appreciate it. Okay, so another partnership that we have is with a technology company that's developed a mobile app. The company is called Copia. It was founded by a student at Berkeley. So she saw that there's a lot of homelessness, but then at the same time, there's a lot of waste in the cafeterias, the college cafeteria. So she created this system where leveraging technology to address these issues of time and transportation, to have businesses utilize this app where they can say that they have, like Costco, one of our partners here, they have 30 pounds of apples. And then a CBO would see this pop up and say, I'd like it. And then they'd arrange for the transportation of that food over to that community-based organization, so then they could redistribute it. So we've received funding to partner with this app. We have 50 subscriptions. We funded 50 subscriptions that include school districts, restaurants, warehouse like Costco, to be able to redistribute this food. I'll take the next slide. You can see that there's a wonderful dashboard that shows us the pounds of perfectly edible food that was donated, the meals equivalents that were donated, the carbon emissions saved, as well as the gallons of water saved from, it's a formula that's used in terms of food. Teresa, I see your question. The app is called Copia. All right, next slide. I'm going to try to get through these last few ones. This is just the last one, I think. So Dr. Wang alluded to this as well, but in February 10th of last year, the LA County Board of Supervisors adopted a board motion to, the pandemic exposed so much, and they adopted a board motion about really focusing on long-term cross-sector coordination to establish a sustainable and just food system, and created a food equity roundtable. It's a pilot project, 2 years. It's funded by philanthropy, and it's bringing together academia, community-based organizations, national nonprofits, all of these partners together to see how we can create a stronger food and resilient food system in LA County. And I think that's my last slide. But okay, I just wanted to end with this quote from Tom Vilsack, Secretary of Agriculture, that he said, "Our nation suffers from nutrition insecurity. We must do more to ensure access to nutritious foods that can protect and promote health. It's a very large problem we have to address, and we cannot have the levels of obesity, diabetes, and chronic disease that we have. It will literally cripple everything we're trying to do as a country." So some even have said that this issue, is it's an issue of national security. We need to have a healthy and thriving population to be able to, thrive in terms of economic development and protecting our borders, whatever it may be. So this is a huge issue, and it's really, there's some major things that are happening at the federal level to support this. So thank you again. I know I'm out of time, and I think we have maybe a couple of minutes for questions. So Dr. Caldwell and I can take those. Thank you.
Thank you so much for that insightful presentation and spreading your knowledge on food insecurity in LA County. We will take questions post Dr. Keller's. So I will hand over the floor to Claudia Keller to speak about the Second Harvest Food Bank. You are muted, Ms. Keller.
Hello, everyone. First off, I'm not a doctor. Do not want to take credit for an academic designation I have not achieved, but do want to thank Julia and Dipa. Dipa, it's great to see you again. I spent 10 years in Los Angeles working for the Heart Association and with LAUSD, and can attest to the wonderful work being done in LA County around food insecurity. Thank you to Dr. Nobari and Eta Sigma Gamma for having me here to talk about food insecurity in Orange County. And I'll always preface it by saying, kind of bringing into light the fact that Orange County is one of the wealthiest counties in one of the wealthiest states, in one of the wealthiest counties on the planet. And today we have, on average, every month, 350,000 food insecure individuals in this county. So I always want to frame our work in that context. I also want to throw out the platitude that the food insecurity that you're talking about, and certainly what Dipa and Julia have talked about in LA County, is not something we're going to food bank our way out of. Food banks are not the answer to this. And give you a little bit of history on the food banking movement. Food banking is about 40 years old. It started in the 1980s and was really meant to be an emergency food system. Ironically, the emergency food system is one of the biggest sectors in the nonprofit world 40 years on. So clearly something is not working. But today I'll walk you through where Second Harvest Food Bank, one of two large food banks here in the county, where we've been over the last 2 years and where the pandemic has brought this food bank in terms of addressing nutrition insecurity here in our county. So I'm going to share my screen. Here we go. I'm going to make that full screen, I think. Can everybody see that? Oh, enable. Sorry. There we go. Can everybody see that? Yes? Great. So that is our food bank. We're located in Irvine, California, in the center of the county. And Second Harvest has been serving Orange County since 1983. So we are one of the legacy food banks in the Feeding America network. You might have heard of Feeding America. It used to be called America's Second Harvest, but today Feeding America is a network of over 200 food banks across the country and is the second largest charitable organization behind the American Cancer Society. So a major footprint. I just returned yesterday from a conference in St. Louis with 199 other food bankers talking about where we are today after COVID. We serve the County of Orange through a network of 250, well, before the pandemic, 250 partners in the community. And those partners are churches, schools, transitional housing units, senior centers, centers for the unhoused, any nonprofit that has feeding people as part of its mission and can live up to the food safety and food handling standards of Feeding America. We are also a major operator of federal programs, such as the Emergency Food Assistance Program, known as TFAP, and CACFP, the Child and Adult Hunger Feeding Program. Today, on average this year, we are serving about, and this is an average, 490,000 people a month. This slide is a little bit old. It's more like 350,000 at this point. We run a series of programs, as I mentioned, permanent school pantries, mobile school pantries, senior centers. We provide food to those in need. And our mission, which has just evolved, our mission is to provide dignified, equitable, and consistent access to nutritious food in the county to act as a foundation for community health and societal transformation. So that is what we do. So I'll start before the pandemic. It's 2 years ago, this past month in March. I don't have to remind anybody of where we've been over the last 24 months. It feels like longer than that. But prior to the pandemic, this food bank was serving about 312 points of distribution and just about 250,000 food insecure residents of the county. We enjoyed the service of almost 30,000 volunteers a year. So we were an organization heavily dependent on volunteer labor and donated food product. And I point those things out because they will become important in our story. Today, we still have roughly 80 staff members that work in our distribution center in Irvine. We have about 100,000 square feet of warehouse and distribution center, a fleet of 17 vehicles, and as I mentioned, a staff of 77. In March of 2020, much like many of you, we realized that the world had changed for all of us, right? We went on lockdown, the schools changed, and what happened here in Orange County was really, really amplified by what the food bank was seeing. So if you remember back to March, businesses started closing, right? Why is this particularly significant in Orange County? A big part of our economy is based on entertainment, sports, restaurants, leisure, and the hospitality industry. That employs a significant part of our labor force here, and those businesses closed instantaneously before the banks, right on par with the schools. So we saw an immediate surge of need. At the same time, our volunteer force was not able to come help us, right? We were on lockdown. We couldn't have social distancing. We couldn't have volunteers in our distribution center, quite literally at the time we needed them the most. Our pantry network, those 312 organizations in communities, we lost 45% of those for much the same reasons. People were quarantining, we went on lockdown, they lost their volunteers. So our distribution network all of a sudden shut down. We realized that we had to make a very, very hard, fast pivot to be able to meet the need. And what you see here in this picture is a pop-up food distribution that, like much of the world, we thought we would continue for a couple of weeks of the pandemic. We were at the Honda Center, you might have seen us on television, serving between 3,500 and 6,000 cars every Saturday morning. When we would arrive at 5 in the morning, there was a line of about 300 cars already queued up around the Honda Center. But those cars and those families included many of the people that we were serving before the pandemic. But what we realized very quickly is that they included many people that we were not serving. These were folks that had 2-income families, owned a house, owned a car, suddenly were in our lines. The newly vulnerable that had never had to access food all of a sudden found themselves on 1 income, on no income, having to homeschool or be at home with their kids when the schools closed down, and we realized the gravity of what was happening. I'm going to try to show you a video that highlights this. Here we go.
Feeding America's hungry is no easy task during this time of disease and surging unemployment.
The financial fallout from the pandemic crisis is triggering a hunger crisis.
In Anaheim, some 4,000 needy households there received free bags of food this morning. Many have lost their jobs to the virus.
I'm out of work. I'm cleaning lady, so I'm here.
At this pop-up drive-through food distribution event at the Honda Center Saturday morning, people came out by the thousands searching for help.
We were expecting this need and we prepared for it, but I will tell you, when you drive up, it is still mind-blowing.
Second Harvest Food Bank supplies food to feed nearly 250,000 people every month.
The food bank is also concentrating on making food boxes for people so they can be delivered to those who might be quarantined.
It's invaluable to know that we have these resources, that we're not going to be going hungry. This food bank cannot close. There are hundreds of thousands of people right now counting on us. And it's not just the food, it's that little bit of hope.
That kind of takes you back, doesn't it? When I watch it, I am amazed at kind of what we were able to accomplish at that time, feeding the county. Oh, now I'm trying to advance my slide here. Ah, that's not what I want. I may have to get out of it real quick to go back to my presentation. My apologies for that. This is what happens when one tries to be high tech.
Feeding a
Here we go. Now I'm back. Sorry about that, guys. So, as I mentioned, we lost our volunteer base at that time. We also had a disruption in the food supply chain, right? We weren't getting donated food anymore. If you can remember going to the supermarkets when many of the shelves were bare, we realized very quickly that we had to buy food. And this is not something that food banks up to this point did a lot of. We probably bought about 20% on a good year of the food that we distributed, and the rest was donated. Well, that supply for us was gone. So we made a plea to the community early on to be able to buy food. The community of Orange answered in earnest. Our donations went right up, and we realized that we were going to be able to buy the food that we needed to distribute during the pandemic. That is important in and of itself from a philanthropic and a human need standpoint. But it did something to the food bank, because we realized that when we didn't have to donate, we didn't have to rely on donated food, that we could choose the food that we would distribute. And this is significant today. Much of the food that we were getting before the pandemic was food that was donated from individuals or organizations. And a lot of it was food that was near its expiration point, near its end of life. And that was the food that we're making do with. We were able to start buying high quality produce, milk, eggs, and lean proteins. And these put us in a brand new situation. This allowed us to go from situational nutrition to planned nutrition, right? And this was a pivotal moment for this food bank. We had gone through, can you guys still see my screen, by the way? Yes? Nod? Yes? Okay. This resulted in a significant change in how we plan the food that we distribute. Through the pandemic, we had to forecast need strictly based on the number of people. So we started a very unscientific method of forecasting the amount of pounds needed based on what unemployment was at that period of time. Today, that plan has evolved into a nutrition plan where we talk about buying nutritious food. And our goals today are really to be able to provide the most nutritious food to those that need it the most. And here you see our plan for fiscal 22. Our plan is to distribute and source almost half of the food that we distribute as produce, about a third shelf stable, about 13% protein, and the balance dairy. Now, dairy and protein and high quality produce are not things that people most in need were finding in food pantries prior to the pandemic. This has changed the game for food pantries and distributors of food in Orange County today. And we developed our logic model going forward. We call our Foundation for a Healthier OC. And I'm not going to read this whole pyramid to you, but basically we believe that consistent access to nutritious food supports mental and physical health, right? And that by supporting mental and physical health, we can improve educational and work outcomes. We can support a healthier workforce. We can support healthier students, and that support can help people obtain more economic opportunities that lead to opportunities for success. It's a bit of a no-brainer, right? When I worked in Los Angeles with LAUSD, I saw firsthand that kids who were hungry and malnourished couldn't learn. It's almost like when you need glasses, you can't see the chalkboard. Health is so foundational to our success as human beings in society today. So today, the food bank is committed to tackling not just food insecurity, but nutrition security and making sure that that's available for everyone. Now, we realize that we alone can't do this, so we support on an advocacy level programs like SNAP and WIC, because the folks that come to our food bank today, many of them aren't aware that they can avail themselves of these programs. I want to take you on a quick tour of our food bank. I wish I could take you all into the building behind me, but I want to show you some pictures of produce. I've snapped these over the last couple of, just about 2 months. If you've ever been to a food bank or a food pantry, you may have images of canned food, government cheese, lots of bread, and food with a long shelf life. I hope I can dispel a little bit of those myths today by showing you what's in our distribution center. Avocados, yes, we have avocados in our warehouse. And of course, oranges. And this is one of my favorite pictures. This is a picture of an egg delivery from Norco Farms, the very first one we accepted. This picture is about 4 months old. Our food bank today purchases 2 truckloads of eggs every single month, as well as a truckload of milk every month. That is our commitment to the vulnerable families that we serve in Orange County, that they can go to any one of our partner pantries and find eggs and milk every time they go. Before the pandemic, it was hit and miss. If there was eggs and milk at the pantry, they thought it was a good day. They thought it had gotten lucky. That is no way to plan a stable, healthy diet for a family, for working moms out there. So our commitment to them is to buy eggs, milk, and protein when we can. A note on eggs, you may or may not be aware, there's a horrible, horrible plague of avian flu taking over the egg industry as we speak. A truckload of eggs, I'm told from our sourcing manager, has gone up over $25,000 in the last 3 weeks. And you may notice, if you're a shopper for your family, you may notice that the price of eggs is going to skyrocket in the next few weeks, along with the price of food, quite frankly. But eggs in particular are being, the West Coast is supplying most of the country as we speak. So think of us when you go buy eggs, we're buying them by the truckload. Another ingenious idea that we came up with during the pandemic, and I'm happy to say that we've been able to act on it, is that we've opened a farm in Irvine, California. We have 45 acres at the South Coast Research and Extension Center, which is part of the University of California, and in partnership with our farmer, who used to be the Secretary of Agriculture for the state of California, Mr. A.G. Kawamura, we are literally farming product to send out into the community. Locally grown, top quality, fresh produce. We're able to do this through a partnership, as I mentioned, with the University of California, as well as an army of volunteers who not only plants the produce, but helps us harvest. So there you see our very first cabbage harvest earlier this year. Today, we have harvested over 637,000 pounds of cabbage, broccoli, celery, and broccolini. And this spring, we will be going forward with bell peppers, summer squash, strawberries, and I believe we're going to make an attempt at sweet corn, not easily grown in Southern California. But it's important for us to take over our supply chain so we can continue to deliver on the promise of nutrition that we have made to the vulnerable families that we support every day. So that is our story. We are not a typical food bank anymore, and I don't think you will find a typical food bank in this state, because we have all learned that our higher calling, our commitment to ending hunger, has evolved really into a commitment to make sure that everyone, regardless of their ability to purchase or not, has the access to the good food that they need. And with that, I'll stop my share and see if there are any questions.
Thank you so much for introducing us to Second Harvest Food Bank and allowing us to learn more about this local resource. And one last thank you to these 3 speakers for sharing your passion about food insecurity and addressing food equities in our communities. I think that words are just words until actions are done. So the work you guys are doing is absolutely commendable and is surely leaving a lasting impression on individuals who are going through food insecurity. And I really like the idea that was brought up of switching the mindset and the verbiage of food security to nutrition security. That really stuck with me. I learned a lot, and I know I can speak for all of my peers here that we're super grateful for you taking the time out of your day to be here. And I will now open up the floor for questions or comments. Feel free to unmute yourself or type in the chat box.
Hi, this is Teresa Yoro from Cal Poly Pomona, where I'm an associate professor. So I work closely with community organizations, activist organizations, mostly folks who are either urban farmers or volunteering alongside urban farms. And so for the majority of those folks, they're already attuned to this idea that we need to be actually thinking about in the long term, you know, about the emergency food system is just that, an emergency, right? Not something that that we want to rely on in perpetuity. And we also want to think about, you know, many of the things that you brought up and that you all are already doing, which is fantastic and amazing. And I'm just so excited about your presentation in terms of, you know, the fresh foods, the fresh produce, and rethinking kind of the food bank model. And so I guess a question that I would have for you is, do you have any suggestions for someone like me who's an academic and an activist to go to an organization like this? There's one in particular that I've been working with for a few years where change is very, very slow, to convince them that they need to be rethinking the model of just accepting donated low quality food from big corporations, and shift to the fresh produce, shift to supporting local farms and farmers. So if you have any suggestions in terms of selling points, I would be really grateful. Thank you.
Who's that question for?
Anyone who feels feels that they're interested in answering. Yeah.
Well, I will say this. I will say that there is a place for a balanced nutritional menu, right? So we do, you know, shelf-stable food is important, right? So we have to be able to, as people that address food and nutritional insecurity, look at the complete plate. We are particularly blessed here in Southern California to have an extended growing season. Yeah. And part of, I would say there are two things that may not be evident to people right away. And the first is that disparities in health, right, fall heaviest on those that are least able to financially provide at any given time for themselves and their families. So this idea of nutritional security is not just certainly the moral one or the obvious one, but it's also the practical one when we look at issues like Julia and Dipa brought up, of obesity, heart disease, and all the other chronic diseases that plague us as a society. So there is a practical, economic and societal imperative here to be able to make sure that everyone gets a healthy diet. The second is an economic one, and that is for the agricultural community. Most people are surprised to know that we are remunerating our farmer. He is not donating his time, his expertise, and much of his equipment, and many of his crew help us. So we want to make our farmers whole to be able to have them continue to provide the wonderful bounty of product that we have here in Southern California for all of us. So I think pointing out the inobvious benefits might help in spurring action quicker, which is what we all want.
Thank you for that. Yeah, so I'm also located here in Southern California in Eastern Los Angeles County, actually. And one of the things that we've been pushing for is for the organization to take because they receive very large donations during the pandemic, because they have a 40-year history in the community and people were just sort of pouring money into that organization. Is to actually pay farmers, right? And so it's been very, very hard to convince them that that's a valuable use of the organization's money. So I do appreciate the insights. Thank you. And I'm going to share the work that you're doing with them and folks that have their ear. So thank you.
Thank you.
I saw one more question in the chat from Justin. His question to you guys is, out of all the types of programs in which you distribute food, such as school programs or college pantries, which one do you find has the most impact in the community neighborhoods?
Claudia, I think that question is for you too, Claudia.
Sure. So I'll first say that I want to take my hat off to our school system here in Orange County, the school districts in Orange County and in LA as well. I don't think a lot of people know that LA Unified is one of the largest providers of school breakfast. I think they're first in the country in providing school breakfast to kids. So this work of nourishing our youngest is really done in a hand-to-hand partnership with our school districts. And we have some significant ones here in Orange County. What we do at the food bank is we try to supplement where we can with after-school meals and help those districts source. I'm not at liberty to say yet, but I have connected a farmer to one of our largest school districts here to be able to provide farm fresh, locally grown produce to our students here in Orange County. And I'm crossing my fingers and lighting candles every night that takes off, because that really is the way I believe school food was meant to be. As to which are the most effective, I would say that whether it's young students in our public school system or our college students, and we know that we have a terrible epidemic of college hunger on all of our campuses here. We have a college pantry on 14 campuses here in Orange County, that anytime you can nourish a young mind to be able to relieve that need and make sure that that basic human need of food, like Pavlov told, not Pavlov, I can't think of his name right now. The hierarchy of needs guy, Maslow, thank you. I don't know why I was thinking of Pavlov. Maslow's hierarchy of needs, we know that we can elevate the human potential by making sure that everyone has that access to the food that they need to be able to think and act in optimum ways. So I would say I can't single one out, but what I do want to point out is that we are not alone. We work with health departments and school districts. It is a continuum of food care that will help all boats rise.
One more question we have that Dr. Caldwell or even Dipa can answer is, if there was one message that you could deliver to policymakers that would enhance your services, what would it be and why?
So local policymakers or states? Do you have a preference?
Let's do local.
Local. You know, the LA County Board of Supervisors has done a lot, you know, to address food and nutrition security, and have adopted, you know, a great deal of board motions, as well as directed resources to food and nutrition programs. I think one of the things is that a lot of this work is addressed towards, you know, the here and now, and, you know, meeting the immediate need, which is necessary. I think the board is off to a good start with adopting the motion to start the Food Equity Roundtable. But, you know, of course, it's funded by philanthropy. So I think the board needs, you know, it would be, I don't even know if I can say this, local policymakers, I think, you know, as an employee of LA County, but, you know, I think really looking at food systems broadly, and looking at ways that we can, you know, build that resilient food system so that, you know, in an event of a pandemic, for example, how can our region be able to continue to provide nutritious food? And that takes a lot of planning, logistics, warehousing plans, you know, all of those things I think is important. But not just actually in terms of a pandemic, but just long term. How do we do better planning? As I was saying, that there are a lot of pockets of LA County where there's no access to, or limited access to, nutritious foods. engaging the planning sector, I would say, to ensure that there is available food within walking distance or a reasonable distance. So in making those investments, so that means, directing resources like financial resources in these communities, especially historically where there has been disinvestment.
Yeah, and I think on the topic of long-term solutions, like you brought up, we did have another question from Josie for you. His question is, are there any programs that were introduced as a result of the pandemic that have demonstrated success or might be models for long-term solutions?
Yeah, that's a great question. And as Claudia mentioned, I'm not a doctor as well, so I don't want to take credit for that designation. Two things I would say. One is that in LA County and maybe other large urban areas, the way that we address food insecurity is in a decentralized way. So, there's the LA Regional Food Bank that's there, and smaller food banks that are in the county. We've got our government programs that implement SNAP, our nonprofits that implement WIC, but people aren't always talking to one another. And I think during the pandemic, one thing that happened was like the creation of this emergency food security branch, where everyone came together. Like, everyone that was dealing with nutrition and food distribution and food and benefits. And we all looked at the data. We looked at how can we make sure that people are enrolled into programs they're eligible in. And if they are not, then how can we make sure that the food bank is going out to those areas that are high in need. So it was really wonderful to have that collaboration, coordination, and communication. So I think one of the things that all jurisdictions can really work towards is having people come together and look at data, and do planning together. So to meet all of the needs in a community and with different segments of the population. Other things that I think that were really well executed and were impactful was the grocery voucher program. One, because and Michael Flood, the executive director of the LA Regional Food Bank, really feels strongly about this, is that you can go to a food bank to get some things, or a food pantry to get some items. Some food pantries have really adopted this client choice model pre-pandemic. During the pandemic, a lot of this stuff was grab and go. But when you give somebody resources to be able to go to a grocery store, there's more dignity with that. There's more there's choice with that. Like a lot of people have cultural, they have different diets due to cultural reasons, religious reasons. So you're able to go to the grocery store and have that choice and have that power of that choice. So I think also having programs like grocery voucher programs are really important for that reason. All programs are great, but to have that added one, I think was really great. That was funded with CARES dollars. We did like $27 million worth of funding for that program.
And if I can add to something Dipa's talking about, choice. Before the pandemic, many food banks were working to amplify choice for their clients. Obviously, the contactless delivery system, the farmers to food box programs, all of a sudden we were putting boxes in cars, which is not ideal. And progressive food banks today are going back to that choice model for the reasons that Dipa highlighted, and also because it minimizes waste. When you choose what you want, you're more likely to eat it and make sure that it doesn't go to waste. When you're getting a box that you had no choice in putting anything in that box, we run the risk of still having waste in our food bank. So I can't say enough for the choice model and how that really needs to be the future of food banking. And I've said we're not going to food bank our way out of this, but choice goes a long way.
A lot of us here are public health majors, pre-med, global health, something of that sort. A question I have for you guys is, do you have any opportunities in your place of work, whether it is at the LA Department of Public Health or the food bank? Do you have any internship opportunities for us, or someone who's interested in working with food insecurity directly in the community? Where would we go to begin that?
We at the Department of Public Health, we have internship opportunities. They're limited. We work with dietetic students, but we do take MPH students. Right now, we're working with Cal State Northridge as one of our local universities, but but you can, if you, in your search engine, look at the LA County Nutrition and Physical Activity Program, you can contact us and see if there's an internship opportunity available.
At the food bank, we're working on our slate of internship opportunities. Obviously, with COVID, we had to limit folks in the building for almost 2 years, which was very sad. But if you go to our website, keep checking in with us. We should be posting some, hopefully before this summer, but we always have volunteer opportunities. So if you're interested in seeing how the inside of a distribution center works, or if you're interested in volunteering at the farm, you can go to our website and sign up for those to get some hands-on, really hands-on work inside of a food bank distribution center or an actual working farm here in Orange County.
Amazing. Thank you so much for all the insight. I really appreciate it. Again, thank you for your time and for being here and spreading your passion about food insecurity. If there's any other questions, feel free to ask them now. If not, our third session will begin soon. It is addressing food insecurity on college campuses.